Okay, this video is basically meant to enlighten and clear some misconception that most married people normally hold out there in the society. The issue is that I have had a lot of, you know, complaint about some couples that experience a few moment where after having intercourse with their partners, the semen usually flows out, and they come with that impression that, oh, maybe because they are not being able to conceive is basically due to the fact that their husband have watery sperms. But with this video, it is important for you to know that it is not actually because their husbands or their partners have watery sperm, but it's just for us to understand some simple concept about the semen of the male. The semen of the male comprises of a very minute microscopic sperm cells that can barely be seen with the naked eyes, except when placed in the microscope. And then other fluids that also accompany the semen, the sex cells, which is the sperm, are actually the Cowper's gland and of course the prostate gland, which usually give it that somewhat yellowish color. And when it is being released in form of ejaculate, it actually looks mucoid and thick, and so it gives it that viscous looks, which normally comes out. But in the semen fluid analysis parameters, there's what we call liquefaction time, and it's just within 60 seconds of its release from the body cavity. So if, for instance, a partner or couples have intercourse, and shortly after the intercourse sperm flows out, it is believed that within that short period of time after the intercourse, the sperm, which was initially viscous and looking mucoid, would have undergone process of liquefaction and become watery and flows outward, giving an impression that, oh, the patient, the man in question has watery sperm. And it is important for us to understand that for a woman who has the potential to become pregnant, the same sperm cells which are meant to impregnate her would have gone long ago before the other component of the sperm semen flows out. And so if she's actually meant to be pregnant, it is not because the sperm flows backward that she will not be pregnant. So if she's not getting pregnant after series of intercourse, it therefore means that she has other related problems, not necessarily because the sperm keeps flowing backward. So this idea of always thinking that men have watery sperm because it flows outward is actually a misconception, which this video is meant to clear. We will also need to know that a man who has watery sperm can only be diagnosed after a particular test, which is called seminal fluid analysis, and after which we look at the seminal fluid analysis parameters, and then we'll now know that, okay, this person has watery sperm. The watery sperm is a colloquial language, but what they mean in actual sense is that the person has low sperm count. That means the number of sperm cells floating within the semen itself at a particular time of release of ejaculate are very, very small compared to the entire volume of the sperm so released. That's why it will now look as if, oh, the person has actually watery sperm, and it is not the case. So I believe that with this video I've been able to clear some doubt and also restore some hope in some people who probably may have been having the misconception that for a particular period of intercourse, when sperm flows out, it is not actually the fact that a man has watery sperm when they see sperm coming out of their body. meaning that they are not being able to conceive. I want you not to only listen to this video, but listen to the video, follow my profile, and then you share so that other people out there in the society who have similar misconception would also use this to clear their doubt and also live a happy life. Thank you for listening.